How many lives have been saved since Toronto's first safe injection site opened here at Yonge and Dundas? Well, this location is dubbed the Works. It's meant to be a safe place where users can inject their drugs using clean needles under the watchful eye of public health staff who are standing by with naloxone in case of an overdose. Now that the city is a year and a half into this program, we take a look at the state of our opioid crisis and if Toronto's attempt at harm reduction is making an impact.
Once they're registered and been through the intake process, they'll come in here, they'll be assigned a booth number.
About 120 people a day, mostly men, make their way through the Works. They're offered clean needles, a tourniquet, a container to cook their drugs, a lighter, and a mirror.
The mirror is sometimes to help people with accessing veins that might be in a more difficult spot, so sometimes they need to use a small mirror.
Assisting them.
Absolutely.
Their drug use.
We're helping them use in a clean and safe way, a much safer way than if they're out on the street.
Dr. Rita Shaheen tells me the purpose of supervised consumption is to prevent overdose deaths, and at this location, she says, nearly 700 lives have been saved.
We've had about 670 overdoses since we opened a year and a half ago. And those, for the most part, have been managed here by staff. Nobody has died from an overdose in a supervised injection site.
Of those cases, naloxone was used 243 times. And in most of these overdose scenarios, you did not have to call 911.
That's right. That's right. So we've been able to take some of the burden off the ambulance service.
But this program is controversial for many reasons. Business owners and residents have complained about drug users and dealers hanging out on their doorstep.
Look, I just went through Yonge and Dundas the other day and watched a drug exchange happen right in front of me as I headed into the subway station there.
Back in 2016, when council approved safe injection sites, Stephen Holliday was one of 3 councillors who voted against them.
It's not like people are going to be swiping their health card at these sites. I'm not sure that we'll really ever know how many lives have been saved or how much value that the investment in this has been bringing to taxpayers of the city.
Paramedics are still on the front lines of the opioid crisis. After a record number of deaths 2 years ago, Toronto Paramedic Services began tracking their response to 911 calls. Here's what they found. In the year between August 2017 and 2018, paramedics attended to over 3,200 suspected overdoses, 161 of which were fatal. The highest number of 911 calls were to the downtown core. The Church-Yonge corridor had 358, followed by the Moss Park neighborhood with 337, and then the Bay Street corridor with 158. The report found an increase in overdoses came in the summer months and that social assistance payment days also coincided with a much higher number of calls to 911. There are critics out there who say, you know, this is crazy. You're allowing people to cook their drugs and you're providing them with everything they need to be addicts.
Well, we know that people will use regardless. They're really a means to help prevent overdose deaths and to prevent infection, spread of things like HIV and hepatitis B and C.
The Works is one of 4 safe injection sites that are currently operating in Toronto, and this location alone has seen over 36,000 visits since the doors first opened.